Okay, so for knee special tests, we're going to start with the sag test. So legs are going to be, hips and knee are going to be bent to 90 degrees, and then you're going to look at the tibial tuberosity and tibial plateau to see if one of them is sagging, and if one of them is sagging, then it's positive for PCL. So next up is Lockman's. So what we're going to do is we're going to have the athlete lay down flat on their back and then bend their knee to about 20 degrees. And then we're going to internally rotate the tibia and externally rotate the femur. So it's going to look like this, and then you're going to pull up, so like that. And that tests for ACL, and the pros of this are that the hamstrings aren't in opposition and the knee doesn't get bent to 90 degrees, because if the knee's bent to 90 degrees, that would be hard if they had an ACL injury. And then the cons are if you have small hands but it's a large athlete. And then the overs test, so we're going to go on the side. And then both the hip and the knees are going to go to 90 degrees. So it's going to go like that, and then you're going to take hold of both the knee. It's kind of hard to see from this angle, but you're going to take hold of both the knee and the ankle and keep your hip stable. And then when you drop the knee and there's laxity, that is positive for IT band. So there's a lot of laxity here. But if there's not, then that's a tight IT band, but this is a loose IT. So next we have Apley's distraction, which is putting your knees at a 90-degree angle while laying on your stomach. And for Apley's distraction, you just put your hand right here and then pull up on their lower leg. And that is for general ligaments. And then Apley's compression is you have the athlete in the same position, you put your hand here again, and then press down on the foot like this and twist the tibia. Just twist the lower leg, and then that tests for the meniscus. So the next one is valgus at 0. So what we're going to do is we have the leg straight and relaxed, just like this, 0 degrees, and you have your hand on the outside of the knee and the inside of the ankle. And what you're going to do is you're going to push outward the ankle, not your hand on the knee, but your hand on the ankle. And that tests for MCL and other structures. And then the next one is valgus at 30. So for this one, we're going to bend the knee to 30 degrees and then have your hand on the outside of the knee and the inside of the ankle. And again, push outward on the ankle, not the knee. And this one, valgus at 30, only tests for the MCL, and in both of these tests we're looking for laxity. Okay, so this is varus at 0. So for varus, it's easiest to just sit between their legs and then hold the leg that you're testing on your lap, and you would have your hand on the outside of their ankle and hold it up, and then you would have your hand on the inside of the knee and then push in, and then it's at knee straight, 0 degrees, push in. This is for LCL and other structures. And then varus at 30 is you bend the leg to 30 degrees and then hold the outside of the ankle again, and then the inside of the knee, and then push in the knee. And that is testing only for LCL, and both of the varuses are testing for laxity of the LCL. So this is the McMurray's test. So what you're going to do is you're going to have both the knee and hip in flexion at 90 degrees, and you're going to put your index finger and your thumb on the joint line, and then you're going to put your hand on their heel like this, and then during it I'm going to be twisting the tibia. So you have your fingers on the joint line, your hand on the heel, twisting the tibia, and so twist the tibia like this, and then also create varus and valgus stretches while you're doing it. So kind of go in a figure 8 with the leg, and then if you want to create even more like laxity and pain, then take them into a deep flexion and then twist their tibia to see if there's any more pain, and this is testing for the meniscus. Okay, so this test is called apprehension. So what I'm going to do is I'm going to push the kneecap laterally like this, and if she flexes her quads or tells me to stop, then that is positive for patellar subluxation. And then the next test is called patella grind, and that is where you put a towel of some sort. I'm just using a sweatshirt, and you put it under the knee, and then you put your index finger and thumb right at the base of the patella, so right above the patella, and then ask them to do a quad set. So do a quad set. And then if that creates pain, then it indicates PFD. Okay, so these last two tests are the drawers. So we're gonna start with posterior drawer. So gonna bring the knee up to 70 degrees and then sit on the foot, and then put your two thumbs on their joint line, and then your fingers back around the back of their calf, and then push down. And that tests for PCL. And then for anterior drawer, you're gonna bring their leg up to 90 degrees, and then you sit on their foot again, and then put your fingers in the same place, but this time you pull, and this is testing for ACL. But another way to do this is internally rotating their tibia, and then sitting on the foot again, and then doing the same thing with your fingers, pulling towards you, and that is for ACL and if there's any more laxity. The pros of anterior drawer is that it's easy to do. The cons, the hamstrings are in direct opposition, and if someone has an ACL injury, their knee might be swollen or and won't be able to get it back up to 90 degrees. Okay, so this is active resistive testing for the knee, and it's concentric and eccentric in both knee flexion and knee extension. So concentric knee flexion is you're gonna have your hand on the back of their leg and keep it where it naturally is, and then push against me. Okay, relax. And then knee flexion for eccentric is you're gonna have them flex their knee all the way, and then put your hand on the other side and resist me. Okay, relax. And then knee extension for concentric is put your hand on the front of their leg and then push against me. Okay, relax, and then bring it up. And then eccentric, put your hand on the back of their leg and then have them resist me. Okay, and that's it. And at the end, you make your concluding statement. So in my evaluation, I found that there was nothing wrong in the athlete, but if you find specific things wrong during the special tests, then you make your prediction based on the results of those tests.